Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about ectopic pregnancy. In a normal pregnancy, fertilization occurs in the fallopian tube. The fertilized egg travels through the tube to the uterus, where it implants on the uterine wall. In an ectopic pregnancy, fertilization occurs in the fallopian tube, but instead of traveling through the tube into the uterus, the fertilized egg implants and grows in the tube. This typically happens in the first 12 weeks of pregnancy. 95% of all ectopic pregnancies occur in the fallopian tube. You might hear an ectopic pregnancy also called a tubal pregnancy. Ectopic pregnancies are not viable and cannot be carried to term. We have seen the number of ectopic pregnancies almost triple since 1985. Today, about 7 in every 1,000 pregnancies is ectopic. Chances of an ectopic pregnancy increase with damage to the fallopian tubes from pelvic inflammatory disease, PID, and other infections, infertility, endometriosis, and tubal or abdominal surgery, smoking, exposure to DES diethylstilbestrol during your mother's pregnancy, and being older may increase the risk. Use of an IUD also increases the chances of an ectopic pregnancy. Researchers believe sexually transmitted diseases, especially chlamydia and gonorrhea, are one cause. If you've had an STD, tell your doctor at your first prenatal visit. Also tell him or her if you had a previous ectopic pregnancy. There's a 12% chance it will happen again. Symptoms of an ectopic pregnancy include cramps or low back pain, tenderness in the abdomen, bleeding or brown spotting, shoulder pain, weakness, dizziness, or fainting caused by blood loss, nausea, low blood pressure. If you have these symptoms, contact your doctor immediately. To test for ectopic pregnancy, your doctor will measure human chorionic gonadotropin, HCG. The test is called a quantitative HCG. The level of HCG increases rapidly in a normal pregnancy and doubles in value about every 2 days. With an ectopic pregnancy, this doesn't happen. If HCG levels don't increase as they should, an ectopic pregnancy is suspected. Ultrasound testing is helpful for diagnosis. An ectopic pregnancy may be visible in the tube. Blood may be seen in the abdomen. Laparoscopy is valuable in diagnosing ectopic pregnancy. Tiny incisions are made in the area of the belly button and in the lower abdominal area. A doctor looks inside the abdomen at the pelvic organs with a small instrument called a laparoscope. An ectopic pregnancy can be seen if one is present. It's best to diagnose an ectopic pregnancy before it ruptures and damages the tube. This could make it necessary to remove the entire tube. Early diagnosis also tries to avoid the risk of internal bleeding from a ruptured tube. Most ectopic pregnancies are detected around 6 to 8 weeks of pregnancy. The key to early diagnosis involves communication between you and your doctor about any symptoms you may have. How is an ectopic pregnancy treated? The goal is to remove the pregnancy while maintaining fertility. Treatment requires anesthesia, laparoscopy or laparotomy, a larger incision and no scope, and recovery from surgery. A non-surgical treatment involves using methotrexate. It is a medication given by IV in the hospital or an outpatient clinic. Methotrexate ends the pregnancy. HCG levels should decrease after this treatment and symptoms should improve. If methotrexate is used to treat an ectopic pregnancy, a couple should wait at least 3 months before trying to conceive again. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.